Well, the best way to screen for breast cancer as of now is to have an annual digital mammogram. In the past, the technology included analog mammography, but now there's a new technique with the new machines that can obtain the information in a much better, quicker way without having as much radiation. That data can be altered so that we can get all kinds of different windows and images using the same pictures. It's also easier to store, and that way the mammograms don't get old or don't get purged. Well, there has been some controversy over the actual age at which women should begin to have mammograms, but I think there's consensus from all the leading societies, including the American Cancer Society, the College of Surgeons, the College of OBGYN, and the College of Radiology, that appropriate screening should begin at age 40 for women at regular or normal risk of breast cancer. Then the recommendations are to start having a mammogram at age 35, and some even say as early as 30. After age 35, there's little or no risk at all of having a mammogram and having the radiation affect the breast tissues. Before the age of 30, I don't think that anybody considers that a mammogram would be useful. However, there are other techniques, including ultrasound and MRI, that can be used. In the last 30 years, there has been a 30% reduction in the mortality from breast cancer. There is controversy as to performing mammography before the age of 40, but it's very effective primarily for the 50 to 70 age group. The 40 to 50, obviously, when you catch breast cancers early, they're much easier to treat, and the survival rates are significantly improved. A screening mammogram should be performed annually and does not require a prescription or a referral from a physician. A diagnostic mammogram is a mammogram that is performed to evaluate a specific problem. So either one that is detected on the screening mammogram, or one, a palpable abnormality, if the lady feels a lump, then we would have to evaluate that with a diagnostic mammogram. Breast ultrasound is appropriate when there's an abnormality on the screening or diagnostic mammogram that requires further investigation. The ultrasound can help characterize the abnormality and will help guide us to a decision as to whether or not the lesion would need a biopsy or further evaluation. An MRI is sometimes necessary, especially if we can't resolve what the abnormality is with normal techniques of mammogram and ultrasound. The MRI is a very, very detailed study, and it's not for everybody, but in the appropriate setting, it's very useful. Self-examinations are very important, especially in a high-risk group. The woman should have a monthly breast exam, but she should perform a breast exam on herself on a monthly basis at the same time during her menstrual cycle. So choosing any day at random, the first or last day of the menstrual cycle, and doing a breast exam is recommended. When breast cancer is detected early, it is a curable disease. As the breast cancer becomes larger, then of course there are more complications, treatment is more difficult, and recurrences occur at higher frequency. So it's important to catch breast cancers as early as you possibly can. So a combination of a careful monthly examination performed by the woman, an annual examination by her physician, and screening mammography is the best way to approach breast health.
For more information about this physician or to schedule an appointment, please call our referral line or visit notbiggerjustbetterhealth.com.